Hello, and welcome to this brief MH Concierge video about how to select a psychologist for your pre-surgery psychological assessment. I am Richard Sethry, and I'm a healthcare psychologist. I have helped over 2,000 bariatric patients get cleared for surgery and get a good outcome with their surgery. I would like to pass on to you what I've learned from doing all these assessments to help you choose your psychologist and get a good outcome too.
This video is intended to provide information for both people who are looking into bariatric surgery and bariatric patients who are in the process of being cleared for their surgery. Your psychologist will assess you in order to make sure that you are psychologically ready for bariatric surgery, but it's important for you to know that you can assess the psychologist to make sure that he has the proper training and background for this specialized type of assessment. First, here's some background information about psychologists. Not all of us have the same interests, training, and background. Some have a master's degree, which usually means that they have had 2 years of graduate school training after 4 years of college. They will usually have MA or MS after their name. Other psychologists have a higher level of training with about 5 years of graduate school after 4 years of college, and they will have PhD or PsyD after their name. Some psychologists also have gone on for more training after they complete their graduate program, such as a postgraduate fellowship or obtaining certification from a specialized training board. The training board's specialized psychologists will have ABEP after their name. Most psychology training programs do not provide training for working with bariatric patients, including doing the pre-surgery psychological assessment. This type of assessment is specialized. Psychologists who want to do these assessments usually need to get additional training after they complete their graduate degree, such as by attending professional meetings or learning to do these assessments under the supervision of another psychologist who is a bariatric expert. You do not want to have your pre-surgery assessment done by a psychologist who has not had some of this specialized education or training. One excellent source of training for bariatric psychologists is the professional organization, the American Society for Metabolic and Bariatric Surgery. This organization has very high standards and it provides training for surgeons, nurses, dietitians, and other bariatric professionals, including psychologists. This slide also lists 2 other professional organizations that provide high-quality training for psychologists who do these types of assessments. You are a consumer of health services. You have the right to ask all of your medical professionals, including your bariatric team and your psychologist, about their background and training. Your bariatric program may give you a list of psychologists who do pre-surgery assessments. These programs, however, usually do not have the time and resources to check on the training and experience of all of these psychologists. You should check out at least a few of these psychologists before deciding which one to work with. Here are a few questions that you should feel free to ask a prospective psychologist. What training have you had in doing pre-surgery bariatric assessments? If the psychologist cannot provide specific information about her training, you should carefully evaluate whether she is right for you. And how many bariatric assessments have you done? If the psychologist has only done a few, then you're at risk for having him learn on you while doing your assessment, and that is not a good deal for you. And how many bariatric assessments do you do per year? If it's only a few per year, you need to assess whether his skills are sharp enough in order to do a good job for your assessment. Here are a few more questions to try to help you have smooth sailing with your psychologist. How many appointments and hours does it take for your typical pre-surgery assessment? Some bariatric psychologists require multiple meetings and that you complete several assessment questionnaires, and all of this can be time-consuming and expenses can add up. Some psychologists are more comfortable with doing brief assessments, at least initially, and adding more meetings and questionnaires only if absolutely needed. And how soon can I get scheduled for my first appointment? Some psychologists are booked weeks in advance, but others save time for these types of assessments. It would be reasonable for you to expect to have your first appointment offered to you within about 2 weeks of when you decide to work with a psychologist. Finally, how long does it usually take you to get your report done and provided to the bariatric program? Some psychologists can be very good about clinical matters, but not necessarily stay on top of their paperwork. It would be reasonable for you to expect that your psychologist gets a copy of his report to the bariatric program within about 1 week of your last appointment. Here are a few more things to consider. If you live in an area with a shortage of psychologists, such as a rural community, you may need to be flexible, such as traveling to see one in another community. Also, keep in mind that you are a consumer of the psychologist services and you have a right to ask questions to help you choose which psychologist to work with. You want to make sure that your psychologist has an assessment plan that fits with your unique situation and needs. It should be what we call individualized assessment. If you need more thorough interviewing and more questionnaires, that is the right way to be assessed. On the other hand, if you need a briefer assessment, that is what you should get. We are now at the end of this video. You are welcome to view my other videos for bariatric patients, with one being why the pre-surgery psychological assessment is required, and the other being what to expect for your pre-surgery psychological assessment. If you want more detailed information about anything related to bariatric surgery, the website for the professional organization, the American Society for Metabolic and Bariatric Surgery, has a section for patients that provides very thorough and high-quality information. Thank you for your time and attention. I hope you found this video to be helpful.